Hello everyone. Today we'll be talking about types of myocardial infarction based on the universal definition of myocardial infarction. So based on universal definition, myocardial infarction is divided into 5 types. So first type is considered as spontaneous MI, that is due to atherothrombosis. That means that if a MI is occurring because of the routine procedure of atherosclerosis, that is the atherosclerosis starts forming slowly, that is the formation of plaque, deposition of lipids, attraction of macrophages and attachment of platelets and all. So the complete atherosclerosis process occurs, and if MI is occurring because of the formation of the plaque rupture, so this plaque, if it gets ruptured, ulceration, and if this is leading to atherothrombosis or MI, then it is called as type 1. Type 2 MI is nothing but there is no atherosclerosis as such, but it occurs because of the supply and demand mismatch. So that means that myocardial infarction is nothing but supposing this is coronary artery and this is the myocardial part. Suppose the supply is less compared to the demand of the heart. So whenever the myocardium contracts, so there is some demand, that means that there is some oxygen requirement of the muscle or myocardium. So to meet that, the supply should be sufficient. Supposing there is a condition where there is no atherosclerosis, but the perfusion is decreased, as you can see in anemia. So suppose in anemia, because the decreased perfusion or decreased oxygen capacity, so no matter there is no blockage is there, but this supply of because of anemia is not sufficient for the myocardial oxygen demand. So that can lead to ischemia, and this is called as type 2 MI, that is type 2 myocardial infarction. It can also be seen in arrhythmias where the heart beats very faster, around 180 to 200 or more than that, and that means that more number of contraction, more is the oxygen demand, and there can be oxygen demand supply mismatch. Also, it is seen in coronary vasospasms. Type 3 MI is nothing but suppose a patient has a sudden cardiac death and that is attributed to MI. So that means that somebody has noticed that patient was having chest pain and sweating, and suddenly the patient has collapsed. Or if the cause of MI is diagnosed during autopsy, then it is labeled as type 3 MI. Coming to type 4 MI is nothing but it is peri-procedure or peri-PCI MI. That means that patient has underwent a stent or called as percutaneous coronary intervention. So there is intervention has been done. That means the stenosis was there. You have put a stent or intervention has occurred. Now the patient has developed, there is stent has got closed, or due to the procedure, patient develops MI within 48 hours after the procedure, then it is called as type 4A. Supposing patient is developing thrombosis into the stent, inside the stent, if the patient develops thrombosis and occurring more than 48 hours, then it is called as type 4B. And supposing patient is developing in-stent restenosis, that means that there is no fresh thrombosis, but what happens is that over a period of time, slowly inside the stent also, there can be atherosclerosis or intimal hypertrophy and can cause stenosis of the stent. This is called as in-stent restenosis. So this is type 4C. And type 5 MI is nothing but suppose a patient has undergone coronary artery bypass graft, that is CABG, and now patient has developed MI within 48 hours. So then it is called as a type 5 CABG. So overall type 1 to type 5. So on summary, there are 5 types of MI. One is type 1, that is spontaneous MI due to atherosclerosis. Type 2 is because of the supply-demand mismatch seen in anemia, arrhythmias, or coronary vasospasm. Type 3 is sudden cardiac death attributed to MI. Type 4 is MI which is associated with percutaneous coronary intervention. 4A is within 48 hours of stenting. 4B is after 48 hours. And 4C is in-stent restenosis. Type 5 is patient developing MI after CABG within 48 hours of CABG. Thank you.